So Sara is a senior lecturer in clinical psychology at the University of Manchester and a consultant clinical psychologist for Greater Manchester Mental Health NHS Foundation Trust. So Sara is an experienced practitioner, trainer, and supervisor of psychological interventions for people experiencing serious problems that affect their mental health. Her research focuses on the development of psychological innovations and understanding of the mechanisms by which they work. She led the development of the psychological approach and therapeutic model for the Compass Pathways funded trial of psilocybin for depression, the largest trial of psychedelics for severe depression currently running. And get this, there are 216 patients across 21 sites in 10 countries across Europe and North America. She designed and ran the therapist training program and continues to provide ongoing support for therapists working in psychedelics. And I'm very excited to hear Sara talk about the importance of psychotherapy in psychedelic medicine trials. Thank you.
Thank you so much, Meg and Joe, and I'm delighted to be speaking at this event today, so thank you all for being here. I thought it might make it a little bit easier if I did have some slides so that you can just follow what I'm saying. And so I'm going to share my screen now, so I hope you can see those okay. Let me just get rid of that. Okay, so as Meg said, that I've been working with with Compass Pathways PLC on their trial, but I just want to make clear that the information that I'm giving today and what I'm talking about doesn't necessarily represent Compass's point of view, and you know, I am speaking from my own opinion, so I'm not representing Compass today. So let me just get started then. Thinking about psychological therapy and support, basically what we do know is that administering psilocybin with no psychological support is probably very physically safe, but it may well be psychologically unsafe. People often talk about what they call bad trips and things, and what we're aiming to do is to really reduce this, because we know that it might affect the potential for therapeutic benefit. Now, in most trials, when people are talking about the psychological support, they're talking about it occurring in 3 different phases. That's preparation, where we actually prepare somebody for the dosing session with psilocybin, the dosing session itself, and then the integration afterwards, which is all about helping them take meaning from their experiences and actually help make sense of that in their everyday lives. Now, to date, most of the trials that have been done have either done what we would call non-specific psychological support. So, for example, this is where there tends to be an emphasis on the role of psilocybin itself. So, for example, I'll give Robin Cartwright-Harris's trial in 2016 down in Imperial. I think they talked about their psychological support being one that wasn't necessarily aligned to a specific therapeutic model, and they described the therapist more as a supporter or a guide. Then there are also what we would call psychedelic assisted therapies, and these tend to be where there's a particular therapeutic modality. So, for example, it might be, for example, cognitive behavior therapy, and it may be for a specific diagnosis. So you'd be providing that therapy, and psilocybin may be added in as an adjunct to whatever's being offered. So what happens in those therapies would be determined more by that unique therapeutic orientation. And I've given some examples here of those approaches. So there's CBT for smoking cessation, there's been motivational therapy, mindfulness, ACT, etc. Now, there are some potential limitations with both the non-specific and therapy-specific approaches. For the non-specific, there is a concern that it might give the message that it's all about the psilocybin itself, and it's the psilocybin which is really the main vehicle of change. Now, I personally have some concerns about that, because I think there's a danger in us overplaying the very important role of neurological mechanisms, but underplaying some of the other mechanisms that we know to be important as well. So social, cognitive, emotional and behavioral processes. And I'm sure anyone who's experienced difficulties involving depression and other diagnoses would admit that these problems are multifaceted, and therefore what we really need are multifaceted approaches. And you know, we really want to make sure that we are thinking about things not just in terms of psilocybin being some magic bullet that's going to solve the problem, but it's an important component of what is a multifaceted approach, where there is as much emphasis on what's going on psychologically as what's happening, you know, more neurologically as well. Now, I also mentioned therapy-specific approaches too. I think there's a slight issue with these two in that we know that most people who come for treatment, or where treatments in the past haven't been successful for them, that comorbidity is a key issue. You know, people don't just have one problem, they have multiple problems often. And we need approaches that are able to deal with many of the varied issues that are facing the people that we're working with. Also, most therapeutic approaches, so for example, you know, a specific therapeutic approach like CBT or ACT, they don't necessarily provide empirical explanations as to what their specific mechanism of change is. This has been a common criticism of approaches across the board. And also, when we're training people in lots of different approaches, it does mean that it can be more hard to manualize these and also test the efficacy of these approaches. Also, many therapies have been criticized because they don't necessarily have unique contributions to what they do. They are often seen to be equal in outcome. They've been described as having what we call the dodo bird effect. And so really, we can't justify the cost of training people in lots of different disorders, in lots of different therapies. For psilocybin, it also poses future problems, potentially, because we would need to compare all of these different approaches in clinical trials. Now, as I said, if they do seem to have equal effects, I think it's more likely that there is some common ingredient across all of these different approaches. And perhaps we should be looking to focus on those. And that's certainly what I'm going to be arguing in the approach that I'm talking about today. So a key consideration that we have is we really need clear, empirically sound and evidence-based approaches to psilocybin therapy. It's absolutely essential if we're going to get this accepted into mainstream clinical practice. Good practice guidelines demand that we have clear theoretical principles, and I have to say there has been a bit of an issue with this in many of the studies to date. What are the clear theoretical principles that guide practice? And in order for us to improve practice, we need more details on this. We need a robust understanding of mental health per se, and we also need the ability to tease out what the effects of psilocybin might be from those non-specific therapeutic processes that are operating. So the theoretical approach to psilocybin that I've been working on is informed by a robust empirical framework, a theory called perceptual control theory. Now, I don't have time to go into lots of detail about that today, but the reason I have chosen this as the framework to inform the work that I've been doing, and that with Compass, is it's a biopsychosocial framework to understanding mental health. It's a functional model rather than a hypothetical model, so it's amenable to empirical testing. And it understands people in terms of the everyday functioning rather than being a model of pathology. And it explains human behavior and how people operate in terms of homeostatic principles. So it basically says that we keep essential biological, psychological, and social variables controlled within pre-specified limits. And I'll talk about this in a little bit more detail. So the main essence of the therapy is that people have unresolved and incompatible internal variables that they're trying to control. And this is what leads to distress. In order to resolve them, we need to have awareness of those internal variables. We need to be able to balance them in a coherent whole. So an example of what I mean by conflicting internal variables might be somebody who's experienced depression. They want to have a meaningful relationship with other people, but at the same time, they also have a standard of avoiding feelings of vulnerability. And therefore, they're flitting between the two and unable to control either to a degree that is meaningful for them and works. So in order to find a solution, people need to have awareness of both goals through increased attentional mobility, introspection, and problem solving. And that's really what we're trying to achieve in psilocybin therapy. Now, this fits with the general literature. You'll hear people like Kohler in the past, where they talked about insight learning with apes and things, how people suddenly develop new solutions. This fits with all of that previous psychological work. And also things like control and conflict are key transdiagnostic processes evidenced within the mental health literature. Now, introspective awareness has been seen to be so important in a whole range of therapies. So this approach really does draw on the key mechanism seen across the literature, and particularly in psilocybin therapy as well. Now, what we're doing in practice is helping people to focus on a problem at hand that may be, for example, relevant to their depression. And we're trying to help them downregulate the usual control strategies, such as rumination, that they may well use that block them from being able to develop awareness and solve the problem. And we often refer to these strategies as being involved in what's known as the default mode network, but I won't go into too much detail about this today. It requires them having a focus and a change in emotional state. So really what we're talking about is a process of exposure. And we're exposing them to emotions and experiences that they haven't been able to focus on before and may be difficult in psychological therapy where psilocybin isn't used. We're trying to help them look at it from different perspectives to really evaluate it in different ways. Now, this is what preparation and the dosing session itself would aim to do. And then in integration, we would help them externally express this, because verbalizing problems and thinking about them from different perspectives is very different to doing it inside your own head. So this just gives you an idea of what the essence of the approach I'm talking about does. We do two main things: self-directed inquiry, which is about helping people direct attention to internal experiences so that they can expose themselves to a range of emotions, cognitions, and physical sensations, and also process those experiences in a way where they can evaluate it from different perspectives, as I just said. Those are the two key things to the therapy. And we use curious questions mostly to help people do this. The potential of psilocybin therapy is really important here. Many psychiatric drugs, like antidepressants, may actually serve to reduce awareness, whereas what I'm talking about is actually increasing awareness. Now, this might be really helpful for reducing the intensity of distressing emotions, but it could have the unintended side effect of making those problems longer term because people are less able to evaluate them in the ways that we're talking about. Now, this really opens the door for psychedelic drugs because it might be that they offer opportunities for increasing awareness, which is quite different. So it's a very different mechanism of change. So just to conclude, what I'm saying here, and I know this is very brief, I'm talking about a principles-based, theoretically driven approach, which builds on what we know to be useful across a whole number of psychotherapies and within psilocybin. We're really saying that people can develop their own capacity to direct their attention towards internal experiences, and the people we work with have the capacity to get themselves better and work out their own solutions rather than being taught or advised and being directed in a particular way. We're talking about awareness and being compatible standards and helping people find their own solutions for balancing the things that are particular to their own lives and their own important goals. And psilocybin, by its capacity to downregulate and make flexible usual cognitive and emotional and behavioral responses, may be a great way to help people develop new strategies and stop using some of the strategies that may have been counterproductive for them in the past. And that's me done, really. There's my email in case you want to ask me any questions. But thank you very much indeed.